The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone, and welcome to the County Health Rankings and Roadmaps webinar on recognizing and building on assets. My name is Mary Bennett, and I'm a community coach with the County Health Rankings and Roadmaps program. I'm joined by my colleague, Stephanie Johnson, also a community coach.
Hello everyone and welcome to the webinar. I'll be sending out chat links throughout the webinar and look forward to fielding your questions today. Hope you enjoy this webinar.
Thank you, Stephanie, and we're excited to have Cristie Upshaw Travis, CEO of the Memphis Business Group on Health, to share how Common Table Health Alliance of Greater Memphis area started by sharing networks, identifying unique contributions, and building on assets to create a shared vision that's now a robust community-wide collaboration for improving population health, health equity, and the healthcare delivery system.
Well, hello, this is Cristie, and I'm really glad to be with you all today.
First, we'd like to acknowledge the important relationship we have with the Robert Wood Johnson Foundation. The County Health Rankings and Roadmaps programs is a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Population Health. Next, we want to take a moment to get you oriented to the technology we're using today. The GoToWebinar attendee interface is made up of two parts. One on the left, you can see the viewer window where you will see our screen throughout the presentation. On the right, you can see a control panel, which is where you can interact with us. Please feel free to ask questions or share your thoughts and experiences with us via the control panel throughout the webinar today. We'll be addressing questions and be sure to leave time for that at the end of the webinar. We like to have a guiding question for all of our presentations. So today the question is, how can you recognize and build on assets to chart your community's unique course to create a culture of health? With this theme in mind, I'll start with a very brief overview of the County Health Rankings and Roadmaps with highlights of relevant resources and tools available on the County Health Rankings and Roadmaps website to further support your work. Then I have the pleasure of interviewing Cristie about the excellent health improvement efforts in the greater Memphis area through the lens of how they used an asset-based approach, both formally and informally. And again, feel free to ask questions so Cristie can respond at the end of the webinar. So we also like to pose these reflection questions. So as you listen to this webinar, we invite you to consider, who else do you need to share this information with? What is one idea for action that you're taking from this webinar? And what else do you need to know to take action and use this information? So as I said, we'll start with this brief overview of the program to ground our discussion in the County Health Rankings and Roadmaps. So if you're newer to us, this will give you a high-level overview of the County Health Rankings and Roadmaps. So to learn more, we encourage you to check out one of our Rankings and Roadmaps 101 webinar. There's one coming up on July 14th, and Stephanie will chat out a link to our most recent recordings. So this picture shows us the thinking behind the rankings, our theory of change about how rankings can be a catalyst for action that improves the health of everyone in the community. As you can see here, we start with the population-based data from a variety of sources. Then we use that data to rank the health of nearly every county in every state. The rankings take several different pieces of data and simplify them. They give communities a quick and easy snapshot of their health and the many factors that impact how well and how long people live. Each year, the rankings are released in March, and it generates national, regional, and local media attention. You can use the report to get the word out in your local media and with others about the rankings, using the report as a call to action. This provides an opportunity for people also, like yourselves, to tell the story of the many factors affecting the health in a community. Community leaders can and do use the rankings release to get the word out, and really throughout the year, to their community, local media, and help people understand the health status of the community. This call to action is intended to help community leaders bring together people from a variety of sectors to look further at community needs. They use these findings as an opportunity to mobilize people to look further at their community's strengths and needs. And based on this deeper look at the unique priorities, community members identify evidence-informed strategies that can be implemented locally to make change. So over time, these evidence-informed strategies ultimately result in longer, higher quality lives for all children and adults in the community. Essentially, the county health rankings aren't about numbers. They really are about a call to action. The county health rankings are a starting point for a discussion in communities, not an ending point. So this horizontal portion of the model underpins the rankings. And as I said, the county health rankings show us that where we live matters to our health, and a broad range of factors impact how long and how well we live. The vertical portion of the model underpins the roadmaps. The roadmaps offer communities guidance, tools, and resources to move from awareness to action to create healthier places to live, learn, work, and play. And this image reflects our approach. So as I said, for each county, you'll find two rankings, one for the health outcomes in green and one for the health factors, which is tomorrow's health. Because much of what affects our health happens beyond medical care, the rankings really underscore how important it is to build a culture of health where getting healthy, staying healthy, and making sure our kids grow up healthy are top priorities. This image also shows the important relationship between policy, health factors, and health outcomes, as it illustrates why it's important for communities to take this broad definition of health. Many factors affect how well and how long we live, like housing conditions, access to parks, the quality of our schools, availability of jobs, access to healthy food, clean air, water, and our social connectedness all impact our health outcomes. So quickly, starting from the bottom, effective local, state, and federal policies and programs can improve a variety of factors that in turn shape the health of communities. There are many health factors that shape our community's health outcomes. We specifically look at health behaviors, clinical care, social and economic factors, and the physical environment. And as I said, we measure the two types of health outcomes to show how healthy each county is. And that's based on the length of life and the quality of life. So for example, a clean air policy is a policy that can influence health factors such as tobacco use, which in turn influences health outcomes. So with that in mind, I want to share the Take Action cycle. and this is the how within the rankings and roadmaps. And it lays out the process communities can follow to improve health. Each step is laid out, starting with assess needs and resources and working clockwise around to act on what's important and evaluate. You'll see that communicate and work together circle around the cycle because work together and communicating with stakeholders are absolutely essential throughout the take action cycle. And most importantly, at the heart of the take action cycle is people working together, because we know solving issues like childhood obesity, poor high school graduation, crime, recidivism require the wisdom and the resources of everyone in the community. We identify these different sectors in the blue circles. So now we're going to turn to where you can find resources related to today's topic. So we're going to highlight Assess Needs and Resources. So by clicking on Assess Needs and Resources on the action cycle, you are led to this page with resources and help to identify strengths and assets. Also on this page, you'll find key activities with several categories of tools, and relevant to today's topic is identifying community assets and resources. Here we'll find suggested tools on the right here. So feel free to explore this on your own. As you click on each tool, you'll find a description. So, for example, on Discovering Community Power, a guide to mobilizing local assets in your organization's capacity, this description states that this tool is from ABCD, Asset-Based Community Development at Northwestern University by Kreitzman and McKnight, and is a community building workbook that helps organization identify strengths, resources, and assets. And as we said, Stephanie will be chatting out these links. So before, and I know we're all looking forward to hearing from Cristie, but now let's set the stage for hearing about Memphis and how they've done this amazing job of maximizing their assets. So what is asset-based approach? So as you can see here, asset-based approach is part of the very foundation of county health rankings and roadmaps. It's about identifying and utilizing individual and community strengths, resources, and connections to mobilize community-driven action. It helps us shift from this deficit model that many of us have worked with, and from needs-based to assets-based, disempowerment to empowerment, and institutional reform to true citizen engagement. You'll hear about examples of these important shifts in thinking and in practice as we hear about the transformative work in Memphis. So now it's my tremendous pleasure to introduce Cristie Upshaw Travis. Just to tell you a little bit about her, she's been the Chief Executive Officer at the Memphis Business Group on Health, a 501c3 not-for-profit business coalition whose members cover over 350,000 covered lives in Memphis and Tennessee since 1994. In this role, she supports employers by bringing them together to share solutions and provides tools for them to manage the cost and quality of their health benefits. Cristie collaborates nationally and regionally to enhance program effectiveness and achieve results from a broader footprint. She serves on an impressive list of board of directors and trustees, as well as numerous advisory committees, both nationally and regionally. Specifically related to being a guest speaker today, she is a participant and former board chair of the Community Table Health Alliance and a member of the Governance Council and co-chair of the Chronic Disease Team for Healthy Shelby, which you'll hear a lot more about in a minute. Cristie has her Master's of Science in Hospital and Health Administration from the University of Alabama, Birmingham. And to put it simply in my words, Cristie Cristie understands the important role of business in promoting health, and her heart and mind is committed to working with the community to drive health improvement for all. So again, welcome, Cristie.
Well, thank you, Mary. I'm really honored to be here. And having an opportunity to talk about the work we're doing in Memphis is really an honor as well, because I love to spread good news, especially from part of the country whose health is not always making the best lists, if you understand my point. So let me tell you a little bit about Memphis first, if I can. I grew up here. I moved away for about 20 years, and now I've been back for 20 years. And Memphis has such a rich culture that's steeped in food, music, and the Mississippi River. And that river really defines Memphis as well as the region that is all around us. Memphis is home to the two top musical attractions in the world. I'm sure you've all heard of Graceland, home of Elvis Presley. Graceland has over 600,000 visitors a year, making it the most visited private home and music attraction in the world. We're also home to Sun's Studio, and it has been called one of the most famous recording studios on the planet. It's not only introduced us to Elvis, but also to Johnny Cash, Carl Perkins, Jerry Lee Lewis, and more. Memphis is home to over 100 barbecue restaurants, and the Food Network just named the #1 barbecue restaurant in the country to be right here in Memphis, which is the Barbecue Shop. And I'm really glad that I included their picture on this slide, which was even before they were named #1. We're also home to the National Civil Rights Museum, which is located in the Lorraine Motel, where Martin Luther King Jr. was killed. Every year, the museum honors individuals who have made significant contributions to civil rights movement. And past awardees have included Frank Robinson, the Dalai Lama, the late B.B. King, Reverend Joseph Lowry, Bono, and Congressman John Lewis. Finally, it's often said that the 2.4 million of us in the greater Memphis area live in the capital of the Mississippi Delta. And although the Delta brings with it such a rich culture and pride, it also brings struggling economies and poverty and the myriad of health issues that derive from the social determinants of health, many of which Mary just talked about earlier.
Thank you, Cristie, for that rich description of Memphis. And Cristie, I know you've worked with many groups and organizations locally and nationally. And today, as we're focusing on your work with others in Memphis, in the Memphis area, to build the Common Table Health Alliance and how your community leveraged multi-stakeholder assets to build this effort. Would you start, please, by telling us how this initiative started and what are some key factors in the development?
Well, I'm glad to, and let me say at the beginning that our original name was the Healthy Memphis Common Table. So if I get confused, please understand we've just changed the name over the last 2 years. But we were originally the Healthy Memphis Common Table, and you'll probably see that referred to on some of these slides. But it all got started back in 2002 when Self magazine named Memphis the unhealthiest city in the nation for women. We were in the bottom 6% for exercise. We had an average BMI of 27.5, and we were below average for healthy eating. If that wasn't bad enough, in 2003, the very next year, Men's Magazine anointed Memphis America's unhealthiest city for men. Seems like we had both men and women totally covered as being the unhealthiest in America. Now, you know how everybody likes to say that, the data's wrong. And I think that's exactly what we were hoping, that the data was wrong and that maybe magazines, who are not necessarily where you go to for evidence-based information on health of the nation, might have gotten it wrong. Unfortunately, I'll have to tell you that they didn't get it wrong. We knew this to a certain extent, but even we were really humbled when we saw that our region, as well as obviously the Memphis area, was, according to the CDC, had the highest prevalence of obesity, diabetes, and other obesity-related risk factors in the country. So even though it was the commercial magazines that called us out, and they really did, our own statistics, when we went to look at them, confirmed that they were right. So let me tell you a little bit about how we got started. Obviously, nobody likes to see themselves declare the unhealthiest city in America for both men and women. So we didn't like the negative national press that we were getting. And that really served as the call to action for us to get together in small groups. And we didn't meet in people's offices. We actually met around dining room tables in people's homes. And you can see a picture of that back in 2002, where the small groups began to organize. We started sketching out what we could do together to help turn our health and, quite frankly, our reputation around. We were very lucky in that an existing nonprofit focused on equity in healthcare was generous enough to seed its organization to the Healthy Memphis Common Table. And we launched our efforts at a summit in 2003. At that meeting, organizations that were wishing to collaborate together signed a public pledge to work together to reduce obesity and diabetes in Memphis. And in fact, they called out your organization's name and your personal name. You walked forward, and we had a great big poster that we actually physically signed, making this commitment. Starting in 2004 through 2006, we engaged the public and the media to build momentum. And we also figured that we needed to have a community spirit. We needed a positive view of Memphis for ourselves, so that we could build on that positive outlook and say we can make the improvements that we need to make. And one of these activities was Tennessee on the Move, and you see a picture there under 2004. And we were very excited about this because the CBS Morning News actually covered us nationally. And given that part of our goal was to change our national reputation, we felt like this was a significant accomplishment early on and really did help build the spirit and momentum for our initiative. However, I would say that the real event that brought us together was in 2006, when we hosted a Shaping America's Youth Town Hall Summit in Memphis. That day, over 1,000 Memphians from all walks of life and many different organizations spent a Saturday together developing a plan on how we could help our children be healthier.
Well, this is really impressive that you were able to really leverage and transform from negative press to positive, and garnering your community's desire to turn the health and reputation around. And obviously, I think the public pledging is really interesting, and other people might be able to utilize that in terms of working together and getting the media involved. So thank you so much. And I'm wondering too, if you could tell us more about how the group then leveraged this. So you had the summit, and how did you move forward from the summit?
Well, this chart that you see, this graphic that you see on the screen, is really a depiction of what we thought Memphis looked like before the Common Table was born and before we started our work. Very disparate groups of people who all had the best intentions in mind but weren't really working together. And so part of our goal from the very beginning was to eliminate this fragmentation, and we felt like that was going to be essential if we really wanted to improve the health of our community. And I think the summit really helped provide and was the catalyst for making that happen. It really helped us galvanize as a collaborative. We had a very specific goal that we had to meet in a very short time period. And the major goal, at least from my standpoint, was to be sure that we filled the convention center. I don't know about you, but I hate giving a party and then wondering if anybody's going to show up. So we had to do very quickly, we had to learn how to mobilize organizations that were focused on childhood obesity in Memphis, and we knew there were many. And we also, at the same time, had to introduce the whole importance of this issue to other organizations and recruit them to become involved. Although we may not have done a formal asset mapping, as I'm sure all of you will do, we essentially worked in that mode, with each organization reaching out within their own sphere of influence to get people to come to the event. We also had to recruit over 200 volunteers. Because we had tables at which the volunteers both had to lead conversations as well as take notes. And there were others who had to obviously volunteer to keep the program running physically, as well as to summarize results, because we actually walked out of this meeting with a plan in our hand. So the summit, since it gave us this plan at the end, was something also that we could organize around. We had a plan that helped us form work groups, that helped us establish goals and objectives. And I don't know how you all feel, but I really think that until you put something into action, it's just a concept. It's just a theory. And we really used the summit as that opportunity to test the theory that we had about whether or not we could galvanize the community and bring people together.
Thank you, Cristie. It's just pretty amazing, again, that you were able to really leverage relationships. That's what I keep hearing you say, and then mobilize those relationships to action. So tell us more.
Well, I'm really glad you used the term relationship, Mary, because to me that's what all of this depends on. One, you do have to know your community. You need to know people across the different stakeholder groups and across all neighborhoods as well as organizations. And you have to develop a relationship with them, which really working together on the summit, I think, helped us to cement that relationship. So you saw on the prior slide that we had all this fragmentation. Now you see how we had a vision for how we could bring all of these organizations together. Some people think in silos. We thought in petals of a flower that needed to be brought together. And we actually became known as the flower people across the country, which for a child of the 1960s I thought was actually very funny. Now I know when you look at these graphics, they aren't really, by today's standard, the highest caliber graphics. But I show them to you today to emphasize the fact that we were, until 2009, a totally volunteer organization. The board and partners brought whatever assets they had to the table, and thank goodness one of them had great clip art skills, which is how we created this graphic.
Well, that is great, and I love the image. And I'm wondering if also you could give us a couple of examples of what efforts grew out of this, and including kind of focus and purpose of who was involved, and of course, as you're so clearly doing, how were assets utilized in building and sustaining this effort?
I'd be glad to. The first one I want to talk about is our Let's Change initiative, which is led by now the Common Table Health Alliance and the Shelby County Health Department. Change stands for Commit to Healthy Activity and Nutrition Goals Every Day. We had a preacher involved in this particular initiative, and they love to come up with these acronyms. Over 30 organizations across Memphis and Shelby County have signed a pledge, and you see here's the second time that we've asked for pledges, that they themselves will model this commitment in their organizations, and that they also would be a champion in the community to recruit others to do so. Basically, Let's Change provides an annual forum on childhood and family obesity. They also serve as a networking opportunity. They have a listserv that's used to keep coalition members up to date on local issues and opportunities. And the Common Table has produced an inventory and resource guide of organizations that focus on healthy eating and active living. And they've just produced their second version of that here in 2015, giving it a refresh and an update. And I'll have to tell you, as a little bit of an aside, I use that resource list all the time. We have a conference coming up in August, and I wanted someone to speak, especially on healthy eating, and was able to go right to that resource guide and find a food hub that we have in Memphis that is going to be part of our conference. So it's a very invaluable coalition. It's very loose. It's not highly structured. It doesn't have a complicated structure or business plan. It has no real business plan, but it puts people together. And I also think the other piece that I want to stress about it is that it is a partnership with our health department, which is a significant asset in our community. And it is a way really for the health department to get more engaged out in the community. And I think that they have benefited very significantly from that as well. Now, as I indicated, Let's Change focuses primarily on networking and best practice. But in a moment, I will share with you how they are beginning to play an even more vital role in our collective impact initiative for Healthy Shelby. So let me talk to you a little bit about Healthy Shelby. Healthy Shelby is really a partnership. It is not even an organization in and of itself. It doesn't have a legal structure that it operates in. It is clearly a partnership among community partners. It's been championed by our mayor for Shelby County, as well as our major area chief executive officers from both health-related and non-health-related businesses across the community. And it's a formal component of Memphis Fast Forward, which is our regional economic development plan. I think this is one of the aspects of Healthy Shelby that I'm the most excited about, because the other aspects of Memphis Fast Forward focus on workforce development, education, crime reduction, and government efficiency. And if you remember the graphic that Mary showed you at the beginning, which is the framework for how the rankings are put together, you remember that so many of these issues are the very ones that are the social determinants for health within our community. And although we haven't leveraged it quite as well as I know we will in the future, being a formal part of an organization that also addresses crime reduction, education, workforce development, really puts health at the core of the organization. So I'm very excited that we are part of that. Healthy Shelby is really working under the structure or framework of the triple aim of improved population health, quality of life, and health care, and reducing health-related costs. Now, the Common Table Health Alliance serves as the backbone organization for Healthy Shelby. Remember, I said they're not really an organization in and of itself, but it was very important to have an organization that could wake up every morning thinking about Healthy Shelby. And the Common Table is also right now helping to facilitate Healthy Shelby's strategic planning process, where we will define specific goals, objectives, and tactics to address hypertension, end of life, and obesity. And I just want to pause for a moment to tell you that this is the second phase of Healthy Shelby. We've actually been operational since 2011, and we have been addressing in our first phase, we've been addressing hypertension, end of life, and infant mortality. I'm very excited to say that the progress that we made around infant mortality really resulted in Healthy Shelby saying we now have, outside of Healthy Shelby, organizations that will continue this work. And so we are celebrating the fact that we have ongoing coalition focused on infant mortality. They're graduating, if you want to look at it that way, from Healthy Shelby to their own organization, and Healthy Shelby is adopting obesity reduction as our third plank. So it's very exciting to have had that type of success and to be able to add obesity reduction as a considered plank for our organization. Now, I told you before that the Let's Change Coalition was beginning to play a role in Healthy Shelby, and this is where it's happening. During this strategic planning process, it is the Let's Change Coalition that is really the core of the design team that will help us as a community develop what interventions we want to address and to take on to improve health and reduce obesity. So since Healthy Shelby is a virtual organization, it depends upon the work of others in the community to meet its goals. So leveraging the assets of other organizations in Memphis is essential if Healthy Shelby is to be successful. I think one of the assets that we've had is the Common Table itself, because they have a large network of organizations that have been working together, some of them since 2003. And the Common Table has experience and expertise in how to bring community organizations together to build something as important as Healthy Shelby.
Well, again, thank you, Cristie, as this is truly an impressive story of what can happen when people join forces. I'm reminded of the earlier definition of building on assets and how you've brought it to life as the Common Table really identified and utilized individual and community strengths, resources, connections to mobilize community-driven action. I almost have this feeling like putting together a crossword puzzle, and when you find one more piece that just fits perfectly and connects as you speak. So can you share with us maybe some highlights of what were your lessons learned in this process?
Well, obviously we learned a lot, and quite frankly, we're still learning a lot. I tell people that community collaboration is also often messy, and so it is through that messiness, though, that you do, as you just described, Mary, find those pieces to the puzzle that actually help you find a solution to the issue that you're working on. So I'm just going to share about three high-level lessons that we've learned. One is that relying on a distributive network to achieve specific goals is very difficult. As I described a moment ago, it can often be seen as messy. One of the reasons for this is, quite frankly, as we say all the time to each other, there is no boss of a region. And, you know, I don't report to the Common Table Health Alliance, I report to my board. And, you know, my obligations as a community organization are to my mission and to my board. And so when I join with other organizations, they are similarly placed. They have obligations that are outside of Healthy Shelby or the Common Table Health Alliance that they have to meet in order to meet their obligations to their boards, to their constituents, to their clients, and to their patients. However, we've all pledged that we want to come together for the common good, which is where the Common Table comes in, and for the greater good. And so the real challenge, I think, is how do you find ways to keep people at the table? Because they don't have to be there. They can walk with their feet. So we are continuously having to build and rebuild the will of people to work together. And I think a lot of that is having a common passion for what you want to achieve, but it's being sure too that you are able to have success along the way. Don't have a goal that doesn't give you opportunities to celebrate success as you are beginning to reach that goal, because it's in those little celebrations that you build momentum and a positive outlook. I think also the public pledging that you've seen in a few of our programs really does create accountability. I know that when they called out Memphis Business Group on Health and Cristie Travis as the CEO is coming forward to sign, I mean, it does kind of put an obligation on your shoulders. And, you know, at that point, I realized I'm really making this commitment. My organization is making this commitment. And even though it might get messy, we're going to stay at the table. And we have. I think another point is having a specific goal and a specific action to give the initiative structure. That's really what the summit back in 2009 did for us. It gave us something to actually do together. And as I mentioned earlier, until you actually do something together, it's just a theory, it's just talk. And Memphis has been known as great talkers, and we can do that, but we need to be action-oriented, and we are action-oriented, and it's through that action that we build the relationships that allow us to really collaborate. I sometimes look at structure as an essential point because it builds a community, and it really builds what I would call a common language among the collaborators, so that organizations kind of know how they fit in and how they work with each other. And then the final piece is that you do need a backbone organization, because otherwise it's just impossible. And even for the backbone organization, it's like they're trying to herd cats. I really do not envy the team over at the Common Table Health Alliance, because since they are not, quote unquote, the boss of the region, they have to find a way to actually guide us and give us that structure and that direction that helps us continue to move forward.
Well, I think that we can hopefully all learn from these powerful lessons, and thank you for articulating them so well. I know that also, as in the image of the flower, many other efforts grew out of this work. Could you share with us some additional efforts that people might like to hear about?
Well, I'd be glad to, and one of the main reasons I want to is that I started off the webinar talking about all the negative press that Memphis had received because of our health. And I don't want to leave you with that negative view of Memphis, because over the last 12 years, we have made significant progress, although we still have a long way to go. So, for example, we know that we have work sites that are creating cultures of health. We have over 61 employers that have signed a public pledge to create cultures of health at their work sites. 45 out of these 61 have made significant progress and have been declared healthier Tennessee work sites, and the other 16 are well on their way. Another aspect I want to talk about is the fact that back in 2008, Memphis was named the worst city for bicyclists. I don't know if you all have trouble saying that word, I do. But now Memphis is recognized as a bronze level bicycle friendly community, and Memphians are becoming even more active. Our restaurants have now many healthy options, and many more restaurants are moving in this direction. Our regional restaurants have stepped up, and they've become REAL certified. And REAL stands for Responsible, Epicurean, Agricultural Leadership. And they're showing this commitment to their customers by offering healthy and sustainable options. And I'll have to say that at the Memphis Business Group on Health's annual awards luncheon back in April, we actually got our luncheon certified by REAL to show that we were willing to walk the talk in terms of healthy eating. And then finally, I want to say that Memphis is now a 4-star sustainable community. The Star Communities, which is a nonprofit in Washington, D.C., named us a 4-star community. Sustainability tools for assessing and rating is what STAR stands for. And I'm particularly gratified by our health and wellness score of 75%. Now, as Mary mentioned, I want to be sure that I am really crystal clear on a couple of things. One is that our community's ability to make the changes that I've just talked about that are evident today was not only driven by the Common Table Health Alliance and its community partners that work through that platform. And to me, that is very exciting. The desire to have a healthier community is beginning to permeate the entire community, and we don't even know of many of the activities and interventions and groups that are focused on improving our health. And I think that's really where we want to be. We want it to be the norm in Memphis that health is a priority for everybody. And so it is not just the Common Table that has brought us to where we are today. The other issue that I need to be sure I'm crystal clear on is that we have not solved our obesity and diabetes problems. We still show up on our fair share of the bad list, but we are also showing up on all of these good lists. And we're making enough progress as shown through these leading indicators that I just shared with you that we know we're on the right track.
Well, yeah, this is, I feel really inspired, and I think that many people on the call also are feeling inspired. So again, thank you for this inspiration. And I know that we started the webinar with this guiding question of how can you recognize and build on assets to chart your community's unique course to create a culture of health. So hopefully many of your questions have been answered, but let's take a few minutes now to open it up to questions for Cristie. So if you haven't already, I think questions have been pouring in, but feel free if you haven't already to chat out in the chat box. So I'm going to hand it over to our capable colleague here, Stephanie.
Thanks, Mary. We do have some questions that have been coming in, and this particular question, Cristie, is focusing on some of those delicate issues like trust issues that we sometimes hear in communities. And so Lynn is wondering how trust issues were overcome in building some of the partnerships and the collaborative, especially as it relates to some kind of sensitive issues like past broken promises or race or class issues. Can you talk a little bit about that trust building work?
Well, I think you've hit the nail on the head. Sorry, I was mixing my metaphors. But, you know, trust, I think, is at the core of all of this. And quite honestly, I think that you have to continuously and continually work on building trust. It is not a one and done activity because new collaborators come in, some leave. Even if the organization is still there, the people may be different, especially as you work together over time. So I think trust is at the core of making this work. We have had to face trust in a number of ways, some of which were just mentioned. Some of the trust can be built by actually listening versus talking, actually beginning to go into each other's worlds, which may not happen just normally in the life that we live in our communities. And so physically going into each other's worlds and getting to know what life is like, especially for different races, ethnic cultures, and especially those who may not speak the same language. I will also say that trust needs to be built between nonprofit organizations, and I don't know if this was being alluded to at all, but you know, nonprofits sit in a position where they may actually be from time to time competing for dollars and for support. And so really trying to get to the point where people say that my success depends on you being successful. That's one of the definitions that I have tried to use about collaboration. Maybe we're just cooperating until I realize that if I'm going to be successful, you need to be successful too, and we need to find that way to make both of us be successful. And it's not always easy, and there is tension that comes around it. I do think that trust issues need to be thought about at the very beginning and not swept under the rug, but actually maybe discussed from time to time so that people can say, yes, you know, it's through the transparency of the discussion that we really address the trust.
Thank you so much, Cristie. And we have a saying here among some of the coaches at County Health Rankings and Roadmaps, which is, you know, to sort of deal with those sensitive and sometimes challenging issues in the room with everybody, and that helps to really build trust rather than dealing with some of those issues after the meeting. You know, how unfortunately, sometimes there are meetings that happen after the meeting, and that just really does not go far at all when we're looking at building trust among partners. So thank you for your insights. I have another question that has come in. William is wondering about some of the unique actions that the 61 employers have taken to advance their work in building a culture of health in Memphis. Do you have some highlights or unique actions that you'd like to share?
Well, I think the Culture of Health initiative itself is a little unique in that the CEO, actually, of the organization is the one that needs to sign the commitment. The other piece is that we do ask each of the employers to select one of 4 different programs that they will use as their pathway toward creating a culture of health within the organization. We think it's important for them to have a framework within which they are working, and that framework be evidence-based. And so we say, which of these 4 would you like to do? Actually, some employers have selected 2 to do. And we really work with them to identify which of those programs fits them best in terms of their own culture and their own capacity to really create a culture of health at the work site. The last piece I'll mention is that we understand that just because you've selected a program and that you might actually implement aspects of that program, that does not necessarily mean that you have a culture of health within your organization. But we also recognize that if you do have a culture of health, it will be visible through the types of activities and programs that are in these 4 national programs that we use. And also that if you're not quite there, actually doing the health-related activities can help spark a culture of health within the organization. And I would say in terms of unique, I'd say there are probably 61 different unique aspects, and I would be glad at another time to be able to share some of the specifics that some of these organizations are doing. But I do think having the framework, kind of going back to what I talked about earlier, having a structure and a framework that everybody is operating in really helps them to communicate with each other and to know whether or not they're making progress. And if we didn't have the framework of choosing one of these programs, it would be really difficult to assess the progress that they're making at the work site.
That makes sense, Cristie. This is Stephanie again. We've had a couple of folks inquire, as you've been talking about the frameworks, expanding on the 4 frameworks or the 4 types of programs from which employers can choose. I don't know if you can speak to that, but a couple questions came in while you were talking on that topic.
I knew they would.
Yeah.
We actually use the American Heart Association Fit Friendly Work Site, the CEO Cancer Gold Standard, WellCOA, and then we have a regional initiative called Healthier Tennessee, Small Starts at Work. And each of these programs has a list of suggested evidence-based activities that employers should think about implementing at their work site. And we feel like that really gives a good framework for employers to know in terms of the mix really of healthy eating, active living or physical activity, tobacco control, benefit, One of the things they do not necessarily address very well in these 4 programs is mental health, which we are working right now on a component of being sure that we add mental health, because these particular programs, all of them are not strong. Well, COA is pretty strong in that area, but the others are not. So those are the programs that we're working with. Everybody who meets the requirements of those programs also automatically becomes a Healthier Tennessee work site.
Great. Thank you, Cristie, for providing some more detail in those questions. And I think at this point, I am going to turn it back over to Mary and wind down on the webinar for today. We will be posting an archived link of this webinar along with the chat links in a PDF document on our website in the days to come. So feel free to look back for that and share the webinar and links with your colleagues. So thank you so much.
Thank you, Stephanie, and of course, thank you, Cristie, for sharing your experience and examples of programs and strategies. As I said before, I feel inspired by the work that you've done there and with all of the region in terms of the great, all the various work that's being done is just so impressive. So as Stephanie said, to kind of wrap up the webinar, I'd like to turn to that. We also know there are many other strategies that communities can and are implementing, and I just want to make sure, maybe many of you are aware of it, but one of the resources that you can utilize on our website is called What Works for Health, found under the Roadmaps to Health tab on the County Health Rankings website. And it's really a great resource to search for strategies that will make the most sense in your community. So we aren't going to do a full tour of What Works for Health, but the play button in the middle of the screen is a 4-minute tutorial on using the database if you're not yet familiar with it, or you can watch a County Health Rankings and Roadmaps 101, which includes the tour of What Works for Health. So I want to quickly share just a few more resources that might be helpful for all of you in your communities as you work on effective strategies in your community. And we also have currently 4 Madison-based community coaches and 7 regionally based coaches around the nations with the County Health Rankings and Roadmaps program. And community coaches provide community leaders with direct support to strengthen their capacity to advance health improvement efforts in communities. Our coaches use the County Health Rankings model, the Take Action cycle and all its resources, as well as the Robert Wood Johnson Foundation Culture of Health Prize criteria as it frames for guidance to support communities to move from planning to action. Just as we talked in the beginning, whether we're the release of the data in terms of the rankings, all of it really is about inspiring action. And our assistance is available at no cost to you thanks to the support of the Robert Wood Johnson Foundation. So also you'll see here the Get Help button, and you'll find these orange boxes located throughout the Action Center inviting you to contact us for personalized no-cost help. This is the best way to really connect with one of our community coaches, and please don't hesitate to contact our coaches if you need assistance with a tool, a question, or just figuring out the next step in your process. So we started with these reflection questions at the beginning of our webinar. So who else do you need to share this information with? What is one idea for action that you're taking from this webinar? And what else do you need to know to take action and use this information? We encourage you to use social media to stay in touch with us and communicate about county health rankings and roadmaps, and there's many ways to do that. And just as in your community, and Cristie has so well demonstrated, this program is a result of many contributions of many partners, including those listed here. So please don't hesitate to contact us as you move forward. And again, I wish we could all hear the applause as we're grateful to Cristie Upshaw Travis for sharing her time with us today, and thank all of you for joining us. We look forward to seeing you on our next webinar.